must complete that this initiative will go a long way to establish Rajasthan on the global map in healthcare as well. Rajasthan has been famous for forts, and the strength of the fort, I think, will be able to make a great amount of initiative in medical health services as well. Well, if I talk about today's agenda, I would like to express a couple of points and share my experiences, and then I will request my other colleagues to share their views. See, CSR, per se, if I say leveraging CSR, I'm sure that CSR being born a few months back or a few years back, and the government implemented the policy to have corporates, companies to contribute 2% of the profitable income to the CSR. I think earlier it was philanthropy. We in India always used to contribute towards philanthropy, and later on, when it comes into regulation, it became CSR policy as such. What is corporate social responsibility is something which I would define as something which is like sustainable. It helps the organization to meet its objective with investing for a long term in the same industry where it could be preferably. If not, fair enough, it can make a better ecosystem, should help the society, the environment, and the main objective, which is continuing to benefit to the society. Now, as an organization, we have been doing a lot of work in the corporate social arena, but what we have not been doing is defining and putting the structures till a few years back. Let me comment on some of the key initiatives what as an organization Fortis would have done. We started with Saksham, which is like a few minutes back, Mr. Suzuka was saying about a number of deaths which occur, and they had an objective of out of 30 million deaths, if we can prevent 1 million, and they were very close to 9.96 million deaths. The idea was that if you can prevent a life, and we came out with a program called Saksham, which is providing a basic life support training, which is mandatory in developed countries. When it is first aid responders or BLS training program, we imparted this training program to first responder. Could be a policeman, could be a auto rickshaw driver, could be a truck driver. In the last 2 years, we've been able to do these sessions of 40 to 50 people who would come to our hospital. We impart them training on the dummies, which are responsive. I mean, they are just not dummies, they would respond whether you will be able to do a good exercise on me or not. And then we go forward. So over close to 4,500 people have been trained for saving lives for future. So we join hands with you, sir, in saying that if there is an accident, somebody can save life and become a doctor for some time, and can, in that case, could refer the patient to the right destination. Nothing Choice is an initiative where we all know that the gender discrimination in Rajasthan and Haryana. So we started celebrating the girl child birth in our hospitals. Over network, we are able to contribute over 26,000 plants being presented to the families, and we give it to the mother, saying that so the girl child would grow, so is this little tree, and would help you to have the nurture of the family, would give you real fruits, and surely would make your ecosystem more presentable. Another initiative was, in India, we have a large amount of babies who suffer from congenital heart disease. We created Fortis Foundation in 2006, and alone in Jaipur Hospital, we would have done over close to 400 pediatric cardiac surgeries, which is absolutely on the cost basis. What I mean to say is when it comes down to our hospital, whatever drugs and principles they will need to bear the cost to let the patient go from all across Rajasthan, Gujarat, or whether they're coming from Haryana. Umeed is an example where we joined up with government, and wherever we find especially privileged children, which they are, for example, especially privileged, we do their preventive health checks and get them ready to face the future as well. Samarth, with State Institute of Family Health Welfare, we educate our budding doctors, and they come over to our hospitals and they are being trained on how to handle emergencies in ICU setup, or we talk about emergency in neonatal areas where it would produce some amount of equipment, saving lives in neonates, and as the main objective of MMR and IMR improvement in our MGDs of the Millennium Development Goals. We started working on this, and probably I would say that there is some amount of work being done. Though a lot is still to be done. Some years back we started working with Government of Rajasthan Department of Women and Child Development with Anganwadi Sahayogini Yojana, where the doctors from our hospitals would travel down to these clinics with far off distances and would provide treatment, preventive one, education for the expecting mother and the newborn child. Now there are most of 2025 programs which we do across the pockets, but let me conclude with one statement, that no organization can succeed globally if it doesn't address the needs of the society or the community it belongs to. And if an organization has to be successful and sustainable, CSR, whether it is in the constitution or not, is the only way to be there, to be the answer to those solutions or those problems which are being lying unaddressed.